Okay, there being a quorum, we will begin the afternoon's hearings. This is our actually third meeting today. We had hearings this morning. We had a briefing, and now we have our last set of bill hearings. Welcome committee, welcome presenters, and welcome anyone streaming at home. We have 8 or 10 bills today, and let me first announce that Senate Bill 231, Public Schools Cyber Safety Guide and Training Course Development, Implementation, Reporting will be rescheduled to a later date. Senate Bill 231, members of the committee, that'll be rescheduled so you can cross that off your list today. Very few of the bills have opposition. I will announce on each bill and the time element. The first person listed has up to 5 minutes. They do not have to utilize all their 5 minutes, and subsequent speakers will have 2.5 minutes. With that being said, Senator Galion, I'm going to go to Senator Young first, if you don't object. And if I don't hear anything, if you're unmuted,
That's fine, Mr. Chairman. It's fine with me.
Thank you. Senate Bill 225, Senator Young, Education, Public and Non-Public Schools, Seizure Action Plans, Brinley's Act. We'll have Senator Young, followed by Lauren Schillinger, Diane Bremen, Lauren DiBettetto, and then we have one unfavorable listed, John Willems. And then we have, we have some favorable with amendments. Then the rest is all written. So we'll start with the proponents. Senator Young, welcome.
Thank you, Mr. Chairman. Good to be back in my old committee.
It's great to have you back.
Brinley's Act. Epilepsy is the 4th most common neurological disorder in the United States, and it affects people of all ages. About 1 in 26 people will develop epilepsy at some point in their life. Johns Hopkins indicated that in Maryland, every school, as an average, has 6 to 10 children with epilepsy. And there are about 7,900 children with active epilepsy in Maryland. So there's only one school nurse per every 913 students. So the Seizure Safe School Act will improve the care for citizens, raise awareness of seizure disorders, and implement a uniform standard of care across the state. This legislation requires that at least 2 full-time personnel at each school in Maryland be trained in applying first aid to those experiencing a seizure. One of those would obviously be the school nurse, if they have one. The legislation mandates that a seizure action plan has to be made part of the student's file, those that have epilepsy, obviously. And the files made available to school personnel and volunteers, so responsible for a student with a seizure disorder. It ensures that the proper medications are administered to students with epilepsy and contains a Good Samaritan clause. Training for a school nurse takes about 2 hours and 15 minutes, and it can be done online or in person, and it's free. And training for school personnel takes about an hour. Training for students is about 40 minutes and takes place in the classroom, and the materials are free of charge. Now, in the bill, the school children would have this training twice in their 12 years, once in elementary and once in junior or senior high school. Presently, 5 states have already passed similar legislation. Well, 4 did, and one, just New Jersey is the latest to pass. With that, I'll let my testifiers go deeper into it, but I'm available for questions if I can take in, if I need to take some.
Senator, if you can hang around, we'll wait till your proponents complete their testimony. Okay, let's start with Ms. Schillinger. Please unmute.
Thank you so much to the chair and to the committee for hearing our testimony today. My name is Lauren Schillinger and I'm Brinley's mom. I just want to put a face to the name. That's my daughter, Brinley. In 2014, at 9.5 months, Brinley began to have complex partial seizures. We went to Children's National. She had every test imaginable and an EEG, and she was unfortunately diagnosed with epilepsy and autism and a rare genetic disorder called tuberous sclerosis complex. TSC causes tumors to grow in all your major organs. And our doctors prescribed Brinley several anti-seizure medications. Unfortunately, they failed to work for her. And at the time, she was having 25 plus seizures a day. In 2016, she had 2 brain surgeries to remove part of her brain. They thankfully did reduce her seizure burden, but the reality is Brinley still has tumors in her brain. She still has seizures at any time. Brinley had a seizure this morning, unfortunately. She continues to take seizure medications, and also at all times, we must carry a rescue medication. A rescue med is used to interrupt dangerous clusters of seizures or seizures that won't stop so that you won't have brain damage or possibly lead to death. I was really worried how this would impact Brinley's future, if she'd be able to go to school. When we prepared for her to go to preschool, we were as anxious as when we had handed her over for brain surgery. Her team actually told us how scared they were when we came to school as parents to provide training for them, since no training is provided. So while other students and families were out getting backpacks, we were trying to give this critical training on our own to her staff so they would know how to help her and what to do during a seizure. Now that Brinley's in kindergarten, our fears continue. We don't want to worry about this every single year from now until when she graduates. Seizures are in the top 3 medical emergencies that happen at school. That's a statistic from the American Academy of Pediatricians, who we have their support, as well as the nurses of Maryland, the school nurses in Maryland. By enacting this legislation, this would protect almost 8,000 children with epilepsy and seizures at our Maryland schools. If Senate Bill 225 becomes Brinley's Act, about 16,000 parents like my husband and myself would certainly rest better at night knowing that our students like Brinley are safe in school. This critical training is free, provided by the National Epilepsy Foundation. They're headquartered in Landover, Maryland. We are going to also actually be releasing a new free training that will be even shorter than 45 minutes. Tragically, kids can die from seizures and they can cause brain damage, so they have to be addressed in a timely manner. So passing this bill would support our schools becoming Maryland seizure safe in Maryland. And we ask for your support and urge you to vote yes for Brinley's Act. It will make a world of difference for our children in these Maryland schools, including Brinley. Thank you so much for your time.
Thank you, Ms. Schillinger. And obviously we're sympathetic to a very challenging situation you face and your daughter. Let's go to Diana Bremen.
Hi, thank you, Chair and Committee, for letting me testify for support of Senate Bill 225. My name is Diana Bremen. I'm an educator with Anne Arundel County Public Schools. I'm also a person living with epilepsy. At the start of each school year, teachers are trained on several health issues, such as recognizing allergic reactions, diabetes, and sickle cell anemia. As I sat in this training, it occurred to me that if one of my students or teacher had a seizure, no one would know what to do. After my diagnosis of epilepsy in 2018, I began researching. I learned that there are 6 to 10 students with epilepsy in every Maryland school. Last year, my hallway alone had 2 students and 2 teachers, including myself, with epilepsy. In the United States, there are approximately 470,000 school-age children with epilepsy versus just 208,000 students with diabetes. I'm not dismissing the seriousness of diabetes, but our 8,000 students and staff who may experience a seizure at school should have the same protection. To someone untrained, seizures may appear to be something different. For example, atonic seizures, once referred to as drop attacks, mimic fainting. Myoclonic seizures, which are involuntary muscle jerks, could be confused with a tic. Absence seizures, which are very common in children, are a blank stare. The child would appear to be unfocused or daydreaming, and teachers could confuse this type of seizure with ADHD. We need to know the signs of seizures. Parents trust that staff will keep their child safe at school. Should emergencies arise, teachers are the first responders. It is critical that teachers know correct safety measures to protect their students. Under this bill, teachers would be provided with individualized seizure action plans for each student with epilepsy so they may respond appropriately. We need to correct dangerous old ways of thinking, such as putting things in the mouth of someone experiencing a seizure. As training explains, we can save a child using stay safe side. Stay with the child, keep them safe from things that may hurt them, and time the seizure roll the child to their side. There may be financial questions, but as we said, this is free training developed by the Epilepsy Foundation. And at this point, it's 45 minutes. I'm excited to learn it will be shortened, but 45 minutes is nothing to save the life of a child. So in requiring seizure recognition and first aid response training for school personnel, we are creating safe schools for those who may have a seizure. I'm urging this committee to please pass Senate Bill 225. Thank you.
Thank you, Ms. Bremen. Let's see if there are any questions for the proponents. Then we'll move to the favorable with amendments and then the unfavorable. So the floor is open if anyone has a question. Senator Riley.
Thank you very much. I have a couple of quick questions for the bill sponsor. Senator Young, talk to me about how HIPAA is addressed in your bill.
Frankly, I'm not sure. Lauren,
So
do you?
why don't you get back to the committee?
Okay,
I think we are trying to discourage identifying specific children with medical issues, and that HIPAA is designed to provide that protection. Number two, you mentioned free training and free materials. I presume this is from the National Epilepsy Association.
yes,
Did they
Yes,
tell you
that's
what it would
correct.
cost to implement this program across the United States, how much they're willing to invest of their money?
Like, am I
I
allowed?
do not. Is Lauren allowed to answer that for you?
Ms. Schillinger, sure.
Okay, so it's only a first year cost of a fiscal note of around $77,000. But in terms of the all the training materials and the training, it's already been developed and provided by the Epilepsy Foundation. Are you asking how much it costs for them to develop the training?
To implement it.
Oh, to be implemented, there is no implementation cost at all, other than the first year cost of having a person to just for the training, you know, actually make sure that it happens. But the training, there's no cost to implement it. It's a free online training that's available today.
Oh, online training, very good.
Yes.
Senator Young, did you have this bill last year?
Yes,
And where did it go?
I think it got lost in
In the shortened session?
the shortened session.
Okay, and my final question, Mr. Chairman, to the bill sponsor. I've heard several times that it helps save lives. Senator, do you know how many children may have died from the unprepared staff and teachers in the state of Maryland?
I do not know that.
Okay, Mr. Chairman, thank you. Maybe some of the other other people can share some of these answers later on. I thank you for allowing me to ask these questions.
Okay, I'm going to ask one question. And I know it's very difficult because you're very close to a challenging situation, but I want you to step back for a minute, all the witnesses and the sponsor. Our committee has to set state policy. We have had bills similar to train people and kids in sickle cell anemia, in how to address anaphylactic shock, and probably 2 or 3 or 4 other either illnesses or crisis situations. And so we have to address the question of how much time and how many different diseases, all very serious. And I don't want to minimize these diseases and challenges to these young people. But we as a committee have to set policy for the state. And like I said, we've been approached on multiple diseases. And it puts us in a very difficult position as to which one is important and which one isn't. Or do we say yes to all of them? Hold on. And whether it's to the school staff, the school nurses, or the whole student body, when we also have an expectation of teaching them reading, math, social studies, and everything else. It's a very difficult situation in terms of placing our committee within. So that's my question. I don't have a simple answer, or nor am I expecting a simple answer, but I want to put that out there because it is a challenge we face. So I'm going to start with the sponsor, and then I will recognize Ms. Schillinger. And then followed with.
Well, in terms of classroom time, it's only going to take 80 to 90 minutes in the entire 12 years of a student's school life. 45 minutes in elementary and 45 minutes in secondary school. And it's only going to take an hour's time of the school personnel once in their career, and obviously someone else if that person leaves, but a 1 hour training class that they can take either live or online. So it isn't a great burden. It's going to cost an hour to one person plus the school nurse, and 80 to 90 minutes in the entire 12 years of a child's school life.
Thank you. We will, Ms. Schillinger, I know your hand is up, Ms. Di Bettetto, but I'm going to hold and move to Senator Washington for another question. Ms. Schillinger, briefly. Please unmute.
May I answer now, Chair?
That's why I called on you.
Okay, I'm sorry. Thank you. I didn't know if you said for me to hold or not. I apologize. So we agree that wholeheartedly, we never would want to prioritize one disability or diagnosis or illness over another. And we understand that it's a difficult thing to select which ones would have this type of training and awareness and recognition and response. But to be honest with you, epilepsy, 1 in 26 have epilepsy, 1 in 10 have a seizure in their lifetime. The issue is that we have to prioritize recognition and first aid because seizures are life-threatening for either a student or a teacher or an administrator. So we have to be able to look at which things are life-threatening versus which things just have a medical response.
Okay, thank you. We're going to go to Senator Washington for a question.
Yes. Thank you, Chairman. Thank you, Senator Young, for bringing this bill. I have a sympathy sort of a support of this type of legislation for two reasons. One, my son has epilepsy, and I know how difficult it was. He was diagnosed when he was 12. Fortunately, he started to have his seizure, not fortunately, but the sort of the most traumatic one that he had was at home. If he had not been at home, I'm very clear that he might not be with us. You know, I think it really is life-threatening. Also, Senator, I put in a bill for pediatric stroke. So, you know, it is a hard row to hoe, but I do think that perhaps we can talk about, there needs to be a way for us to figure out how do we address both the healthcare needs and challenges that students have, and making sure that our staff are trained to recognize the signs, particularly when it's a life and death situations, both stroke and seizure, because their occurrence is much more than what we recognize. So isn't that so? So again, I'd like our committee to just really think about, I know we have an ideological position on this, but I think we need to figure out how to address a range of issues in this.
Thank you, Senator, for your points. We're going to go with favorable with amendments. Ms. Robin Elliott. Ms. Elliott.
Great. Good afternoon, Robin Elliott. I'm here today on behalf of the Maryland Nurses Association. We are favorable with amendments. I'd like to thank both the Senate and the House sponsor and the advocates for working with us. I know the sponsor is going to, I think just waiting from the amendment room, be submitting amendments that address the nurses' questions, and you've heard these questions from us before in other bills. And primarily, we just want to make sure that the function of medication administration and who in a school is authorized to administer meds, that remains under the school nurse for safety reasons. And so we thank the sponsor and the advocates for working with us on that. There is a school health nurse, I think, following me who can help address any clinical questions.
Okay. Ms. Gorman.
Bennett is one of our White House correspondents.
Hi, I'm Christy Gorman. I'm the president.
Hold on, someone's got to mute. We're hearing about the downtown activities. Okay, Ms. Gorman.
Good. Okay. I'm the president of the Maryland Association of School Health Nurses, and I'm also an elementary school nurse. I'm here to say that school nurses serve a pivotal role that bridges healthcare and education. that children with unmet health needs have a difficult time engaging in the educational process. Children with chronic and complex medical problems are coming to school in increasing numbers, and they deserve access to their treatments in school so they are ready to learn. Until Maryland can have a full-time registered professional nurse in every school building, all day, every day, it's important to have measures in place to keep children like Brinley safe and healthy so that they can remain in school. I appreciate having the opportunity to speak with the bill sponsors and the parent advocate for this bill. Our discussions involved clarification that school nurses remain the point person for medication administration and to ensure that the bill's provisions align with the Nurse Practice Act. And after our discussion, we came to an agreement to ensure that the bill is now consistent with school health guidelines. So thank you to the sponsor and advocates for their commitment to ensure all children can participate in our educational system.
Questions for any of the presenters on the amendment? Okay, seeing none, we'll go to the opponents. John Willems. I'm not sure I see you on the screen, Mr. Willems.
He's not. I don't see him being present.
Okay, well, apparently Mabe is against it, and I assume there's testimony.
He just joined, Senator Penske.
Okay. Let's give him a second. Mr. Willems, if you are with us.
He's not. I don't see him being present.
Okay, well, apparently Mabe is against it, and I assume there's testimony.
He just joined. He's on.
Okay.
Mr. Chairman, members of the committee.
Second. Mr. Willems, if you are with us. Mr. Willems, you're on. We just finished the favorable and favorable with amendments. So unfavorable against it. Now on the next meeting. There's testimony.
He just joined.
Okay.
Mr. Chairman, members of the committee.
Second. Mr. Willems, if you are with us. Mr. Willems,
Yes,
you're
Mr.
on.
Chairman.
We just finished the favorable and favorable with amendments. So against it. Now on the next meeting. There's testimony.
He just joined.
Okay.
I appear to be having some delay and technical difficulties, but maybe is in opposition. Refer you to our written testimony.
Mr. Willems, if you are with us. Mr. Willems, John, if you have the YouTube on, can you shut it off? I apologize for the technical difficulty. And then, John, if you want to come back on audio and video, we are ready for you. John, if you have the YouTube on, can you shut it off?
Okay, is that better?
Difficulty.
Okay, sorry about that.
And then, John, if you want to come back on audio and video, we are ready for you. John, if you have the YouTube on, can you shut it off? If someone has their YouTube on, could they make sure it's off? I think we're getting reverb because of the YouTube. Whenever there's a second of silence, jump in with your testimony.
Can you hear me now? Okay. Boy, I apologize for this. I'm just about live in Ways and Means at the same time in support of a bill. And so appreciate the opportunity today to testify in opposition to Senate Bill 225, as we did last year, recognizing the school nurses have worked through their association on a series of amendments. We have tended to collaborate in good faith over extended periods of time on the diabetes health guidelines and implementation legislation. the sickle cell legislation, and really it's the concerns relative to the across the board universal training and the curriculum elements of this bill that we feel go much further than either of those other two recent bills, and which is to say that there is probably a path forward for me to support with amendments if the bill was significantly modified to align more closely with particularly the diabetes legislation that this committee passed just a few years ago.
Questions for Mr. Willems? Seeing none, that concludes the hearing on that bill, Senator Young's bill. We will now move on to Senator Galion's bill, and then we'll deal with Senator Bailey's bill. So we are moving to Senate Bill 129.
Senator Pensky, I'm sorry. We have a witness from Senate Bill 225 that has yet to testify. She was a sponsor witness, Ms. Lauren DiBattista.
I apologize. You didn't testify, Ms. DiBattista?
No, I did not. No.
I apologize. Please, Christine, I'm sorry.
That's okay. Thank you so much. I appreciate your time. First, I wanted to show you all a picture. It's a picture of my son Gavin's 4-year-old preschool class. It was taken in the year 2016. He was a happy, healthy, typical little boy. About 1 year after the photo was taken, 2 unprovoked seizures led to an epilepsy diagnosis for Gavin. 2 years after diagnosis, his epilepsy became drug resistant. Since that time, Gavin has had countless hospitalizations, missed many, many days of school, and took on brain surgery like Brindley. He currently takes 4 AEDs twice daily in an attempt to make it through the day without seizures. But even with that, seizures still persist. Another child in that same photo, Katie, she went on to have a single seizure in the summer of 2019. Coincidentally, Katie's mom brought our family a meal in the days following Gavin's brain surgery. As a friend who lent support and a sympathetic ear, she was aware of the various ways seizures can present and how to respond. It was this awareness that allowed her to react with knowledge to her own daughter's seizure occurrence. The day that class picture was taken, no one would have predicted epilepsy or a seizure would become part of Gavin and Katie's story. So this piece of our story really kind of demonstrates those statistics. I strongly believe that this legislation will give our school communities the tools to act from a place of awareness, knowledge, and preparedness when handling seizures. Right now, when I talk to other parents of children with epilepsy, I hear a common theme. They're telling me things are inconsistent and there's a patchwork response to our students' needs. This legislation is truly urgent in allowing us to do better for those children. And my son Gavin is here and he just wanted to share a quick sentence or two as well.
Hi, my name is Gavin. I am in 3rd grade at Central Elementary School and I have epilepsy. When I have a seizure, I need other people to know what to do to help me and keep me safe. Please make the schools in Maryland seizure safe. Thank you.
Thank you, Gavin, for that great testimony. A close friend of mine's 25-year-old daughter has epilepsy, and while the challenges continue, she's doing great, and I'm sure you will too.
Yeah,
So
he's a trooper.
Thank you. Okay, now that concludes the testimony. And again, I apologize for overlooking you.
Thank you, Mr. Chairman.
Yeah, okay, we're going to go to Senator Galion, 129, and that'll be followed by Senator Bailey. This is Hartford County Liability of School Bus Contractors. I believe we've heard that before. We're going to have Senator Galion followed by Stephen Davis, Stephen Nelson, and Aaron Appell. And then we have one unfavorable, George Talley. So Senator Galion, welcome.
Thank you, Mr. Chairman. Senate Bill 129 is a local Hartford County bill For the members on the committee from last year, this bill was heard last year. We got some clarifying amendments done, and ultimately the bill passed unanimously in both the committee and also on the floor of the Senate. Unfortunately, on the House side, due to the shortened session, it ran out of time, and that's why it didn't get through last year. One amendment will be proposed that will make this bill a Hartford Senator's bill. And briefly to recap, county-owned buses in Hartford County are insured through MABE, or the Maryland Association Board of Education, and their liability is capped. Contractors are also insured through MABE for up to $1 million, but due to their private status, they do not have the benefit of a liability limitation that applies to county-owned buses. Bus contractors have attempted to obtain excess liability coverage above the $1 million MABE coverage, but are unable to do so. Many of these contractors have family-owned farms that use excess land available to store buses within their rural communities that they serve, thereby reducing bus drive times and supplementing the farmer's income. This liability limitation jeopardizes their livelihoods with the risk of a judgment in excess of $1 million. There is no reason to disadvantage bus contractors with liability in excess of that $1 million cap applicable to county-owned buses when all the buses serve the same functions and are subject to the same operation and safety standards, with the contractor buses possibly even more. And they have excellent records for safe operation. I just want to point to the bill folder where the Attorney General opinion is in there from a year ago. And also, one last thing, I want to be very clear. This liability cap would not apply if the act constitutes gross negligence, reckless, willful, or wanton misconduct, or intentionally tortious conduct. So that's where I'll leave that, and I know I have some panel members.
Okay, let's go to Mr. Stephen Davis, followed by Stephen Nelson.
Senator Penske, start with Stephen Nelson. I'm sorry, Stephen
Okay.
Davis is coming.
Okay, Mr. Nelson, would you please begin?
Yes, thank you, Mr. Chairman and committee members. Like Senator Galion was saying, we've been working on
in earnest. So if you look him up, you kind of sound like
Just got muted. Here.
You're muted, sir. Okay.
I'm back. Okay. It's just, we're just asking, like you say, for a cap on the liability. We have tried numerous times and different ways to get additional liability insurance. Several years ago, the county did provide a $2 million liability insurance on our buses, but several years ago, they reduced it to $1 million. They said there'd never been a claim that big, but as we all know, things have changed a lot in the last few years, and we're just asking for some help to try to protect our business and our family livelihoods and stuff with this cap on the insurance. Any questions or anything for me?
We're going to hold on questions for just a moment, Mr.
Okay.
Nelson. Mr. Davis, can you join us and unmute?
Yeah, I'm trying to, sir. I
You
have some
are.
computer problems.
We can hear you. Just
okay.
But you can.
Oh, hi. Sorry about that, sir.
Please begin. Mr. Davis, please begin.
I'm sorry. What exactly? I just hopped on here in reference to, I apologize for my lateness and I lost track of time. What would you like me to begin? Just talking about the Senate bill that we have, or
Yes,
is there a question I'm supposed to answer?
No, you are there to talk on why we should pass this bill. You have 2 minutes.
Okay, we've worked on this bill for over 5 years. My family has been in the school bus business for 50 years. We've never had a claim or an issue with a bus accident. The reason I started looking into this was I wanted to spend my future with the buses. And if there was ever an accident, my insurance agent told me that I was unable to buy an umbrella on top of the policy. If there was an accident, I was scared I was going to lose my farm and my whole life, really. So I started embarking on this journey that got us here today. And again, I'm sorry I'm late, but it's been a long time that I've been working for this. I want to spend my whole life in the bus business. We celebrated 50 years and I'd like to do 100 years. It's hard for me to spend the rest of my life in it if in case there was an accident one day, I lose my whole farm, I lose my business. And with how people are nowadays, it seems as if they're easier and more tempted to sue somebody or say that on the internet or publicly, share the information, get more people behind them. I thought the best way to do it is come to you guys, come to our lawmakers and find out, see what we can do to work together. In case you were in my shoes, you would understand like, okay, I understand where this guy's coming from. What can we do to help him? And like all the rest of the people, not just me. It's really everyone. So that's really what I'd like. And hopefully I explained it okay.
That's fine, Mr. Davis. Let's go to Aaron Appell, and then we will take questions.
Okay, thank you very much. Aaron Appell here with Capital Strategies on behalf of the Maryland School Bus Contractors Association. The Maryland School Bus Contractors Association represents the statewide private companies that contract with local school systems to transport school kids in the state. We make up approximately half of the school buses that run today in Maryland. Approximately half of students in Maryland are transported by private contractors who contract with school systems. And this bill, which you all saw fit to pass last year, you all saw fit to pass it out of your committee. It did pass the full Senate floor, as Senator Galion mentioned, and went over to the House where the session was obviously cut short. And so it didn't proceed from there. But it basically would just provide a cap on liability. Contractors are currently in Harford County provided $1 million of liability insurance through MABE, the Maryland Association of Boards of Education, as part of their contract with the school system. It used to be $2 million, but was reduced several years ago. Contractors who are concerned about the lack of additional coverage went to the school system and asked them to reinstate the $2 million. And that was repeatedly denied by the school system and had multiple conversations with MABE. That effort has been unsuccessful. They sought to get additional coverage through commercial insurance companies. As part of the written testimony that the contractors provided, you can see multiple instances in which they were denied. And always the reason for denial is that no one wants to provide secondary insurance on top of a self-insured policy. And that has always been the issue. So they're sort of stuck between a rock and a hard place, and that they're unable to get additional insurance. The county-owned buses that operate in Harford County are all capped, as are all of the other board-owned buses throughout the state, are all capped at $400,000 per statute. That bill was changed from 100,000 to 400,000 in 2016. So that is the cap on all of the county-owned buses, and the contractors in Harford County are just asking that you do as you saw fit last year to do, and pass this legislation to cap them at $1 million per their liability coverage through MABE. Thank you.
Okay, questions for any of the favorable witnesses? Any questions for any of the favorable witnesses? Obviously, we did have this last year. Seeing none, we'll move to unfavorable. Thank you all. Mr. Talley, if you'd like to unmute and join us.
Yes, good afternoon, Mr. Chairman, members of the committee. Thank you very much for this opportunity to present testimony in opposition to Senate Bill 129. there are, I think, 2 or 3 major concerns that the Maryland Association for Justice has. I'm the legislative chair for the Maryland Association for Justice. We're commonly referred to as the trial lawyers here in Maryland. The first is that this is the first step towards a domino effect, as every county is going to want the same cap for its contracting school bus drivers. We just heard from the proponents that every county has contractors like this, and that half of all the buses in every county are privately run. Why wouldn't every other county, if this bill passes through both houses and is signed into law, want the same thing? It's going to go all over the state. And that's a problem, because what you're doing is saying, when private entities who can be held liable to the children who are injured by negligence, those private entities can be held liable for more than $400,000. But we're not going to let the children get their medical bills paid. We're not going to let the children get the fair compensation that the law would allow them to get. In the idea being, the problem is solvable in ways that don't involve capping damages. I'm not sure why, but I would imagine the legislature could order MABE to offer more insurance. It sounds like the contractors want to buy more insurance. You order them to buy more insurance, or find a different way to get them more insurance. They should have more insurance. They want to provide more insurance coverage for these children, who are the most precious cargo one can imagine riding on a common carrier like a school bus. As far as the cap is concerned, and this legislation, the last thing I would point out is there's nothing here that, once there's a cap at whatever the liability coverage might be, well, then why wouldn't MABE reduce the coverage to $10,000? And now the school bus contractors have $10,000 in insurance, and they're complying with the law, and the children are basically riding an uninsured school bus. There's no floor here. If you want to say $1 million is the right number, then say $1 million is the right number and put it in the bill, rather than allow children who would have no idea, and they'd never know that these school bus contractors just got cut from $1 million down even further from where they started at $2 million. Children who are injured in accidents should have access to compensation to pay medical bills, to pay for long-term care. And, you know, if there's a catastrophic accident, which God forbid there should ever be, families are going to want to know why there's not enough insurance when the company used to get $2 million in coverage, and now they've got whatever it is with the time of the accident. They're going to want to know why. And we're concerned that this bill is the first step towards statewide limits that allow buses to run with inadequate, and I think the proponents are even conceding $1 million is inadequate for their purposes. It doesn't provide enough protection, and we're concerned that you're allowing them to get away with maybe even less. And that's the reason we asked for an unfavorable report. Thank you for your time. Happy to answer any questions.
Questions for Mr. Talley? I have two. Well, I'm sorry, Senator Washington.
Oh, go ahead. You can go first.
It's my understanding that in statute, we do have a floor of $400,000. And to change that, they'd have to come to the legislature. Am I wrong on that?
No, that's true. There is a cap on boards of education that's separate from the Local Government Tort Claims Act or the State Tort Claims Act. And that cap currently is set at $400,000 per event. And so even if it's a school bus full of kids, the kids each don't have $400,000. It's a $400,000 shared among all the children on the bus. It's also grossly inadequate, but that's the law. And that's not this bill.
Right. And my follow-up question before we move to Washington and Senator Galion. Granted that it's possibly not high enough. Currently for the local boards of education, it's $1 million. Short of us raising that for the local school system and the contractors, should the contractors be treated differently than the local Board of Education?
So the contractors negotiate their contracts with the local school boards of education. And those terms are, the school boards of education are within their rights to require contractors to carry more insurance than a state entity or a county entity would be required to take. And it's up to the individual counties what they want to negotiate and how they want those contracts to be written. And because the county boards are answerable to the people, they have responsibilities to make sure that contractors who transport children are sufficiently insured. But I don't think that we're asking that we limit the discretion of county boards of education to negotiate those contracts as they see fit.
Do we know, and maybe this is a question better asked of Senator Galion, I don't think I see testimony from the Hartford County Board of Education in favor or against this. I mean, given what you just said about they have the authority to negotiate contracts and limits, apparently it seems that they are silent. Is that your understanding?
I don't have any information about what position the County Board of Education would take.
Okay, Senator Washington, followed by Senator Galion.
Thank you, Chairman.
Followed by Senator Fry-Hester.
Yeah, thank you. And Mr. Davis, I would like you to be in business for 100 years as well. So thank you. Even though it was Russ, it was very compelling testimony. And so my questions, are not about not allowing you to be able to protect that precious resource. It's really about kind of what the last testifier, the last witness spoke to with, I guess, Senator Galion, I want to understand how this really is a senator bill, how this really is just Hartford County. And I know that because it does seem to me to be setting a precedent, and also that the target should be MAIF and raising the limits and raising their access, their ability to get it. I mean, that's the fight I would like to join you in, so that his farm can be protected. So can you help me understand why this is?
Sure, and
maybe Senator, hold on.
Yeah.
Just, I'm going to allow it, but procedurally, these are questions on unfavorable. For proponents, I'm going to let it happen. We can obviously have this debate when we have a markup session and a voting session. And I understand.
I appreciate it. It's just we're not able to. I would walk across and talk to him if we were.
I fully understand. Senator Galion.
Thank you. I can
respond to Senator
one thing.
To respond to Senator Washington and the other comment, I think you had a question for Mr. Talley. So please.
Okay, and I can wrap it up both because they're related. My question would have been, the big difference is when you talk about doing this statewide or local, sure, something could be done at the state level, but in some counties, we're comparing apples and oranges here. So in some counties, they're mostly government-owned buses. And that was a question I was going to ask the opponent was, I believe he said it was like 50-50 county and my data does not show that. It shows depending on the jurisdiction, the different jurisdictions have different percentages of, mostly contractor buses with very few county-owned buses or vice versa. It's kind of all over the place. So the main answer for why to do this as a Hartford County bill at this time right now, the main reason is, my constituents came to me in Hartford County with this issue that relates to Hartford County, may relate to a few other counties. I'll give you that. But the other thing is, this is a concern they've had for many years. They're the first ones that I know of to raise it, and they did directly at the county level. And, if next year we want to look at a statewide bill that, I'd be more than willing to work with you, Senator Washington, or whoever else on that, if there's something we can do in a broad umbrella. But at this time, I think it's very important for my constituents in Hartford County to get this piece of legislation passed, because as you know, sometimes you turn something statewide, it muddies the waters a little bit, and legislation can sometimes get killed that way. So I'm looking out for my constituents in my home county of Hartford County, And I think this is a very, very important bill. And that's the short answer, Senator.
Thank you. Let's go to Miss Senator Fry Heisler.
Thank you, Mr. Chairman. I was just interested in the point that Mr. Talley made about the difference between the two levels of insurance. Can you explain to me the policy rationale for the local contractors who report directly to the county? Why do they have less insurance? From a parent's perspective, if my kid gets hurt, why does it make a difference whether they're private or public contractors? My kid's still hurt.
So thank you for that question, Senator Fry-Hester. First, let me address Senator Galion, if I may. I was basing my comment first that, this is a Harford County senator's bill, and it would only apply to Harford County. The concern I have is that every other county is going to get in line if they've got private contractors. And I believe, and maybe I misheard the testimony, but the proponents suggested that it is true statewide and that half of the children was the testimony I heard. And again, if I misheard it, I apologize. That half the children in the state are transported on private contractor buses. And if that's true, then I can't imagine why every other county isn't going to want the same protection for its contractors if that protection is written into the law for Harford County. As for Senator Fry-Hester's question,
Mr. Talley, it may be that half the jurisdictions, but I'm not sure it's half the students. Obviously, in Prince George's, Montgomery, Anne Arundel, Howard, they're fairly large, and I think they're generally all run by the county. I think in terms of 24 jurisdictions, there may be half, but I don't know the actual data.
All right. So in any event, if I misspoke or misheard the testimony, I apologize to the committee. That's not my intention to mislead you at all. With regard to the question, under current law, government entities, and that would be the state has its own Tort Claims Act with its own cap. Local governments have their own Tort Claims Act. And Senator Fry-Hester, you may recall some of this from your time on JPR. The state boards of education have their own separate cap, and that separate cap is different from the local government Tort Claims Act. Historically, that's just a quirk of the law. I don't have a specific explanation for why they're treated differently in the law, but they are. And then the issue is always true that if you've got a catastrophic event involving students where the Board of Education would be the defendant, and that would be true for a public bus, but not for a private contracted bus, then that cap of $400,000 per event that is covering all the children involved in the crash, that would apply. That's the effect of a liability cap. And a liability cap such as is proposed in Senate Bill 129 would have the same effect. It would just be 1 million instead of 400,000. And if $1 million in coverage is inadequate and the contractors want more coverage, I don't know. We would suggest that capping their liability at 1 million means you're essentially writing into the law that the coverage is inadequate for children who even ride private buses and not buses that are operated directly by the boards of education. I hope that answered your question. I mean, to a certain extent, I don't know the historical answer, but there is a difference. It depends on who's driving the bus and what insurance coverage they have.
Okay, I think we have enough information to take this up when it comes up and is listed for a voting session. That does conclude the hearing on that bill. Thank you, Senator Galion, for introducing it, and thanks for the witnesses.
Thank you.
Move on to Senator Bailey, who has two bills, neither of which have any opposition. We're going to do Senate Bill 104 first. Public and non-public schools, electric retractable room partitions. Senator Bailey will be followed by Sally Devendorf and then Bill Dotson. And then there's no opposition. And then we will go to Senate Bill 239, where again, I believe there's no opposition. So retractable doors, Senator Bailey, welcome back to EHE.
Thank you very much, Mr. Chairman. It's nice to be back to see everyone. Mr. Chairman and Vice Chairman Kagan and members of the committee, I'm here today to introduce you to Senate Bill 104. This creates safety standards for the use of electronic retractable room partitions in Maryland schools. We actually had this bill last year. It was Senate Bill 104. This is the identical bill to that. Remember, Senator Kagan, you were on this bill with me last year, and I would also welcome your support this year, as this could be the first Bailey Kagan bill, and it is cross-filed by Delegate Queen, also from Montgomery County. But what we're talking about here is regarding a 2018 tragic accident that occurred in Virginia, where a student at an elementary school died from injuries that he sustained when he was crushed between the electronic retractable room partition and a wall. That following year, Virginia passed bills to prevent future incidents of this kind from occurring in their schools. Senate Bill 104 has been drafted based on that legislation that Virginia is doing. We always want to be extra cautious when we're dealing with our children. Even at our homes, residential garage doors are required to have electronic eyes. At our schools, garage doors are required to have electronic eyes. These partitions should be required to have them as well. This day and age, it's 2021. We should have mechanical walls that operate without, we should not have them. They should not operate without electronic eyes anywhere, particularly in our schools. This bill says that a school employee may not operate an electronic retractable room partition in a school building unless one of three conditions are met. That's that the partition can be operated if it has a safety sensor. It has an electronic eye. The other two say that the partition can be operated if there are no students present in the school building, or if in the room where the partition is located, the room is locked and otherwise free or inaccessible to any students. This bill requires that school employees be trained to be able to operate this safely, and it also requires both public and non-public schools, and requires that the Maryland State Department of Education to publish model safety guidelines that will be online. As I said, this was just like 258 last year. It passed out of our committee unanimous, passed the Senate 45-0. I respectfully request a favorable report on this Senate bill. I'd also like to say that Wesley's grandmother, the young boy who died in this tragic accident, Ms. Devendorf, is here with us today. Thank you.
Let's start with Ms. Devendorf. Please unmute.
Can you hear me?
We can.
My name is Sally Devendorf, and this is Wesley. I am Wesley's grandmother. Wesley, a 9-year-old third grader, was killed 2.5 years ago in his elementary school in Virginia by an electronic partition in the school's gym area. Wesley was actually asked by his teacher to participate in the operation of the partitions and was crushed between a partition and the wall. Wesley's death has left a hole in my heart that will never heal. Our family is destroyed. I know that there is nothing that I can do to bring Wesley back, but I'm determined to do everything possible to see that such a tragedy never happens to another family. To that end, as Senator Bailey said, I worked with Virginia Delegate Mark Sickles and others to get Virginia to pass House Bill 1753, ultimately named the Wesley Charles Lepicki Bill, which establishes regulations concerning the operation of the equipment and mandatory training of operators. It mandates that no children be in the area of operation unless there are sensors restricting the partition operation. Senator Bailey's Senate Bill 104 is virtually identical to the Virginia bill that passed unanimously. Maryland is to be commended for being proactive in establishing such legislation now, not waiting for a preventable tragedy to occur. At this point, I would also like to say that it is my fervent hope that schools and school districts will find the funds to be able to accept the infrared sensor option in the bill, because these sensors will protect everyone, even against the careless behavior of adults. And this has happened in the past year and a half in Virginia. I'm pleased to address you today to urge you to pass Senate Bill 104. Our children need the protection of this bill now, and school administrators need to know of the seriousness of the matter. I am a member of the American Society for Testing and Materials, and have been working for the past 2 years on a committee to develop an international standard for the use of electronic partitions. The final ASTM standard will be voluntary, as are all ASTM standards, but will carry the weight of this premier organization. Another step in the right direction. Thank you for your time and attention.
Thank you, Ms. Devendorf. Thank you. Obviously, it was a great loss. Mr. Dotson from Modern Door.
Yes, my name is Bill Dotson. I thank the chairman and the committee for having me here today. I own a company called Modern Door and Equipment. We're located in Southern Maryland. We started in 1985 in a garage with 3 people, and we're now the largest movable wall company in the United States of America. So I come here today to testify Senate Bill 104 as an expert in movable wall systems, being the largest supplier distributor of those systems in the United States. And I'm qualified to explain why the technical reasons we need the bill. I'm aware of and spoken to before Wesley's grandmother, and I definitely applaud her advocacy. It's so admirable. My company was involved with the incident at Franconia Elementary School where Wesley died. It was a partition that we sold and installed. As a matter of fact, the day after the accident, I had to meet the Fairfax County Police where the accident was reenacted, and it was a horrific scene to know what happened that day and that we lost the life of a young child. The accident happened basically because that partition did have a safety system, but the safety system was 2 key switches. As his grandmother said, the teacher held one key switch and the child held the other. Certainly not the intent of the system. But had we had an infrared system in place, it would have been an override system that would have stopped the partition when Wesley entered the path of the folding wall. This was similar. We looked up and found over 6,000 deaths that occurred in the United States with garage doors over a 25-year period. And of course, garage doors, I believe it was in the late 80s or early 90s, as a national law, required these photocell systems to be installed in every garage door system in the United States. And so this bill would provide something similar. As was stated earlier, within a year of this incident at Franconia Elementary, Virginia did pass a bill that required the safety systems being added to operable walls. Since then, my company has put safety systems on about 390 operable walls in the state of Virginia, making all those walls not only have 2 key switches, but also have the safety system. Myself personally, I'm also dedicated for the rest of my career to do things, even to make my industry self-police itself. For example, we're now putting warning stickers on the key switches that were not there at the time of the accident. So now the key switch actually has a warning system with the international sign that shows the crushing, the symbol for crushing. The vast majority of the walls in the state of Maryland outside of Montgomery County do not have safety systems. It's interesting to know that Montgomery County, since about 1992, require safety systems on their operable walls. So the walls that I have installed in Montgomery County have the safety system, I-system, but nowhere else in the state of Maryland have we installed a safety system on the operable wall.
Mr.
So,
Dodson,
based
you're,
on-
Mr. Dodson, you're going to have to wrap up.
Okay, that's what I was going to say. Based on what I've said today, I just strongly support Senate Bill 104 for the safety of the kids, and so that what happened to Wesley never happens in the state of Maryland. Thank you very much.
Questions for the proponents? Senator Ellis.
Thank you, Mr. Chairman. I appreciate this hearing, and thank you, Senator Bailey, for this bill. I just offer my condolences to Grandma, Ms. Devendorf, for your loss, and truly tragic. And I'm just wondering, why do we need government to tell industry to do the right thing? So, Mr. Dodson, thank you for being here. Appreciate you being in Southern Maryland and Charles County mainly, and all the people you employ. I just want to know, why do you need a law to tell you to put these sensors on the door? Could you just go ahead and put it on all the doors you sell, since you're the largest manufacturer? And
I know the answer to that one. Unfortunately,
Okay.
sir, it's
Sure.
money. The sensors are incredibly expensive. I'm sure Mr. Dodson can tell you that as well. It should be made a part of the equipment. It shouldn't even be an add-on. But when you're talking roughly $5,000 a partition, it begins to get heavy. And this bill and the Virginia bill, if followed, would accomplish the same thing. It's just a question of compliance. If you have a system like the infrared sensors, even, as I said, against the carelessness or uninformed adult operation, it would do the job.
okay, yeah, thank you. And okay, I understand. We're saying some people wouldn't put it on voluntarily, but I'm sure if you have a situation like this, the insurance companies with the manufacturers would say, hey, this causes a lot of liability, and so it would become like standard equipment, like in cars. Why can't it be a standard equipment that goes on these doors by the manufacturers? So that was my question to, I guess, I don't know if Mr. Dodson can answer that. And thank you, ma'am, for your input with that. But Mr. Dodson, being an expert witness, I would just like to see from your perspective as a manufacturer, what's stopping you from just putting these sensors on your door and not wait for a law to tell you to do it?
You have to unmute, Mr. Dodson. You have to hit
Okay. So what happens in school bids? And first of all, I
think it was a pretty straightforward question, Mr. Dodson.
The
Just give
school
a
bids are
straightforward answer to the
competitive.
senator.
The school bids are competitive. Usually there's 3 bids required. So unless all 3 manufacturers were doing it, one would have a disadvantage. So the specification has to require it. But certainly, you're right, the spec could require it.
Thank you. But I have a follow-up question, Mr. Dotson. In the 130,000 schools across the United States, how many unfortunate events that saw Miss Devendorf's son get crushed? How many other deaths have there been over the last year or 5 years?
I would say in my career, I've been here 30 years, 3 deaths.
In the United States?
To my knowledge, 3.
Okay, thank you.
That is more than that. I mean, it's over about 15 years. There were 11.
Okay, 11 and 15 years, 130,000 schools. Okay. Seeing no further questions, and that concludes our witnesses on Senator Bailey's first bill. That bill is completed. We're going to move to Senate Bill 239, then we're going to go to Senator Sidnor. And I misspoke before. With our new system of entering your testimony or signing up to testify, some people are making the deadline, some are not. There is some opposition. I believe it's written that is not in the file in front of me, but has or will be coming in. So I didn't want to misspeak on that. We are moving to 239, prohibition on possession of tobacco products by minors. Senator Bailey, and he'll be followed by Scott Smith, Kathy Allen, Tim Cameron, and James Smith. Senator Bailey, you're on. Unmute, please, Mr. Senator Bailey.
Thank you, Mr. Chairman. Sorry about that. Members of the committee, I'm here today representing St. Mary's County, and I'm here to introduce to you Senate Bill 239, which is actually the bill that prohibits the possession of tobacco products on school buildings and on school grounds in St. Mary's County. This is a local bill. You will see in the file, just to let you know, there's a delegation letter, letter from the commissioners, superintendent letter, the Board of Education letter. The sheriff is on the call with us. We've also we've been dealing with the state's attorney. So across the board, we have support for this. If you remember, in 2019, we passed legislation raising the minimum age to purchase tobacco products from 18 to 21. And whenever we do things, there are unintended consequences. As a result of that, the legislation repealed the prohibition on a minor possessing tobacco products or electronic smoking devices. So St. Mary's County school system became concerned about the students possessing tobacco products in our schools. That's when we started talking with the sheriff, the state's attorneys, and the school administration, and they requested the introduction of this local bill to assist them with keeping tobacco out of our schools. As a parent, I have actually gone into the schools and seen children with vaping products walking down the hallway. That is something that in a school we should not see. The purpose of this bill is to ensure that these tobacco products can be removed from school grounds and ensure that children who are using these products get the help. And I want to stress that, get the help that they need to quit using them at all. Tobacco by minors, particularly with the increased use of e-cigarettes, is a serious issue. As you may be aware, and several of your counties are doing this. The jurisdictions are suing e-cigarette manufacturer Juul for marketing their products to minors. And if you take a look at those schools, Baltimore County, Anne Arundel County, Howard County, Frederick County, Garrett County, Montgomery County, all have filed lawsuit against Juul due to the vaping epidemic that is occurring in our schools among young people. This bill, Senate Bill 239, is narrowly focused and only applies to the possession of tobacco products by minors on school property and does not impose a criminal penalty for this violation. A violation of this law would be a civil offense. And for the first violation, this would result only in the minor being required to attend a tobacco cessation program. Colleagues, I respectfully request a favorable report on this local bill. And when you look at it, you see the support of everyone that we have in the county. Thank you for your consideration.
Thank you, Senator Bailey. Let's go to Scott Smith, followed by Kathy Allen, followed by Tim Cameron.
Well, good afternoon, Chairman Pinsky and Vice Chair Kagan and all members of the committee. Senate Bill 239, as Senator Bailey stated, prohibits a minor from possessing a tobacco product or an electronic smoking device, such as a vape, inside a school or on school grounds in St. Mary's County. A violation would be a civil offense, and a minor who violates would be issued a juvenile civil citation. This is exactly what we had before the passage of the legislation raising the age to 21. Over the last decade, teen smoking was reaching historic lows, but with the advent of electronic smoking devices, specifically vapes, and the marketing of those products to minors, a surging epidemic of vaping has taken school systems across the county by storm. According to a 2018 study done by the University of Michigan, the percentage of 12th graders who reported vaping in their lifetime rose to 42%, up from 35% the previous year. And now that's before we get where we are now with a pandemic and a year of interrupted schooling. One of the most serious aspects of the epidemic is that long-term effects of vaping on developing brains will not be known for decades. The dangers of nicotine, more concentrated in vapes than traditional cigarettes, as well as toxic chemicals and metals in many e-cigarettes, means that our vaping kids may be doing lifelong damage to their health. There have been reported cases of vaping causing respiratory issues, cardiovascular problems, and even seizures. According to the National Institute of Drug Abuse, 2/3 of teens believe their e-cigarettes only contained flavoring and had no idea about all the other harmful and cancer-causing substances. The Institute also discovered that about 30% of teens who start vaping progress to traditional smoking within a series of months. Now, St. Mary's County Public Schools, we're struggling to deal with this epidemic, but one thing is clear. We cannot solve this problem on our own. This legislation reflects the comprehensive approach that includes prevention, education, and indeed consequence. We look forward to continuing our work with families and the health department and law enforcement with this legislation. So for all the reasons stated above, St. Mary's County Public Schools supports Senate 239 and urges a favorable committee report. I thank you for your time.
Thank you, Mr. Smith. Ms. Allen?
Chairman Pinsky, Vice Chair Kagan, and members of the committee, thank you for your time today to speak to Senate Bill 239. My name is Kathy Allen. I'm Vice Chair of the Board of Education of St. Mary's County, and I'm here today on behalf of the board to support Senate Bill 239. As stated by Senator Bailey, the bill was filed as a result of concerns raised with him following changes in previous legislation that removed all penalties for youth in possession of tobacco products in various forms. We appreciate his understanding of our concerns regarding student usage of all forms of tobacco products. Senate Bill 239, as noted, applies only to schools in St. Mary's County. The first consequence for possession or usage is attendance in a smoking cessation class, which will provide valuable education and assistance to students to reinforce the dangers of the use of tobacco products. Currently, the class is available to students at no charge, but students are not required to attend. Any subsequent infractions would subject the student to civil rather than criminal penalties. We do feel that some form of accountability by the student is important to discourage use, and the requirement to attend the smoking cessation class program stresses education on the topic first and foremost. Importantly, we also know that parents are often unaware of their children's use of tobacco products, and we believe that this bill will help ensure that parents are part of the conversation, another critical aspect of education and change. It's for all these reasons that the Board of Education of St. Mary's County believes that this is a reasoned approach that will assist us in protecting the health and well-being of our students we respectfully request a favorable report on Senate Bill 239. We thank you for your consideration and for your time today.
Thank you, School Board Member Allen. And let's go to Sheriff Cameron if we could.
Thank you, Mr. Chairman. Good afternoon. I am St. Mary's County Sheriff Tim Cameron. I appreciate the opportunity to testify in favor of and advocate for Senate Bill 239. This bill prohibits minors from possessing a tobacco product in a school building or on school grounds in St. Mary's County. A violation would be a civil infraction, and a first offense would result in an educational class on smoking cessation.
Sheriff, we're losing volume on you.
Okay, I'll try to get a little closer. Is that any better, sir?
Not much. You started out great, and then it dissipated.
Yeah, any difference now?
It's not great.
I'll try a little bit, talking a little bit louder.
You got it now. It's fine.
Good. A violation would be a civil infraction, and for a first offense would result in educational class on smoking cessation, an educational approach to making healthy lifestyle changes and reducing teen risk behavior. We've seen a resurgence of teen smoking, especially in the use of electronic smoking devices. The long-term effects of vaping are not yet known, but we know the effects of nicotine addiction, and we're just beginning to learn and understand the negative effects of vaping. This bill is a very comprehensive approach that addresses the problem with prevention, education, and appropriate civil penalties. I ask you to support Senate Bill 239 through a favorable committee report in order to give our school-age teens a healthy, risk-free environment. Thank you again for the opportunity to be heard.
Thank you. Vice Chairwoman Kagan, please, first question, followed by Senator Ellis.
Thank you, Mr. Chairman. Questions primarily for the Senate sponsor, if I could, Senator Bailey. When we do local bills, there is something that's called local courtesy, unless it creates a precedent. So I'm wondering if you're aware of any other local jurisdictions that have already enacted this, so it wouldn't be the first one and wouldn't be created precedent. That's question number one. And question number two, I have three questions. The second question, I'm worried about biased enforcement and whether kids of color might be stopped more often and penalized more often. So if you could address any possible protective measures on that. And then my third question is, could we reach the same end result? Because I agree, we don't want kids smoking and vaping, and we all know the health implications and stuff. But is there the possibility of using school rules and school penalties rather than a state law? So I don't know if that's too many all at once, Senator, but if you can take a hack at that, that'd be great.
So I'd say the first question, I know of no other system or no other county that has implemented this because quite frankly, when we brought this bill last year, there were many of my colleagues that had no idea of the unintended consequences of what we actually did in 2019, right? So we're actually, unfortunately, the ones that caused this problem for not only the youth, but also for law enforcement. As far as bias, I'm going to refer and let my good friend Sheriff Tim Cameron speak to that in his enforcement and his school resource officers enforcement. And and you said three questions, and I'm usually limited to one. So if you go ahead and remind me your third one.
Yes, the third one was, could this, do we need a state law? Could this function well with school policies about smoking and vaping?
So as far as talking to the state's attorney and working with their office, when we went to the school board came to us, we went to the state's attorney. They are the ones that recommended that we do this through a state law, that would be the cleanest approach, and it would give us the opportunity to help the children the most. And that is why we are here.
Okay, thank you, Senator Bailey. Sheriff, if you can help us with that middle question.
Yes, ma'am. Your question, I believe, was towards bias enforcement.
Yes, sir.
So I think it would be one more process that we would ingrain internally. We track all enforcement processes, this is one that we would track, which would give us a breakdown of the data for the enforcement. We'd watch that very closely like we would every other process where we track data, stops, car stops, arrests, things of that nature.
Thank you.
And I'm sorry if I could.
Briefly.
Sorry, as the superintendent of St. Mary's County Public Schools, we track all of our discipline data and we disaggregate it and report it out publicly at the end of each year. The discipline data specifically for tobacco use is not disproportionate. It's never been disproportionate. It pretty much aligns to the population within the school system. The largest challenge that we have is, yes, we do indeed have a code of conduct, and there is indeed a consequence for having tobacco products on schools, conferences with parents, loss of privilege, escalating to all the way up to suspension from school if you are indeed distributing. Up until the passage of the bill to raise it to 21 years, we would also be eliciting the participation of the school resource officer, who would be writing a citation which would compel the parents to become involved and engaged in the process, and then attend mandatory tobacco cessation classes.
I could just ask a follow-up, Mr. Chairman. So why is it that the school resource officers couldn't do this and do everything that you just said without a state law?
They don't have any, it's my understanding that they would have no standing because no offense has been, no law has been broken.
But if there's,
so they no longer would be involved in the
okay.
a child.
I don't want to debate the bill. I'm just seeking to understand it. Okay. Thank you, Mr. Smith. Thank you, Mr. Chairman.
Senator Ellis.
Yeah, thank you, Mr. Chairman, and good to see you again, Senator Bailey. Senator Kagan is right on track with her questions. So instead of having 5 questions, it's down to maybe 2 questions. So my question is, these are kids getting citations, and most kids don't work. So who will pay these citations?
So the first time that they get, that they would be apprehended for this or caught with tobacco products, there is no citation. The first time it simply brings the parents in, and they work directly with the school system so that they can then attend a tobacco cessation program so that they realize. The second time is when it is a $50 civil penalty. And that penalty, quite frankly, should be paid by the parents.
Okay, so
you want to get the parents involved. This is quite frankly, when you talk to most parents, and the parents are saying that they didn't know their kids were doing this.
Yeah, so I understand what you're saying, and you know, I have grown young people now, right? So when they get the teenage years, right, they're going to do what they want to do, and sometimes they don't listen to their parents. And so you have parents who are struggling, parents who are at the edge of poverty, and they're teenage kids who think they're grown. They want to do adult things and do things our society say it's cool. And these parents will be bound with additional burdens. And so I have a problem with that. Secondly,
quite frankly, Senator, they had to buy that vaping device first, right? They had to actually make that purchase. And if they're buying it from someone at school, sometimes in the afternoons, these are being sold for $40 a joule in the schools. So quite frankly, those parents are making that money available somehow to those children, and they need to know that it's being done in violation of the law.
Okay.
Back to you, Senator Ellis.
So thank you, Mr. Chairman. So secondly, I've personally saw my own eyes, public officials, adults, vaping at school functions. Why just put this with minors? Put in all school personnel, adults, parents, anyone caught with any tobacco product on the school system subject to these fines.
I would be more than happy to work with you next year on a bill that would deal with everybody on the school system. But this bill clearly deals with the minors and the ones that need the help the most.
Okay, thank you.
Okay, Senator Washington.
Thank you. Thank you, Senator Bailey, and thank you for folks speaking on this. And I appreciate your concerns, and I share your concerns about the targeting, the marketing of products. And in fact, I have a bill that I hope you support around flavored tobacco products. And again, that bill is directed towards the producers, right, and those who sell it. And so I have two questions. One, have you contemplated or looked at restricting the sale of these to minors and to penalizing those individuals in your county who are selling to minors?
That question I'm actually going to refer to our sheriff.
Businesses are currently prohibited from selling tobacco products to anyone under 21.
Mm-hmm. So how's the enforcement? So I guess enforcement isn't working too well in that regard.
So, yeah, it's a great question. So when we do enforcement, we're doing enforcement targeted at the businesses. Mm-hmm. But what we see, and I think it was mentioned, is that these teens get the jewels and they go to school and sell them for escalated prices. So the mere possession of it is not a violation of law. So again, that was the unintended consequence of a previous bill. So now we're left with only being able to enforce businesses selling to anyone under 21. It's not a possession issue. It's just a sale of.
Yeah. So my second question has to do with my, spending a year on JPR and voted for the law that you're talking about that removed these types of penalties and to reduce the interaction of young people with law enforcement. That was in fact an intention, and Senator Huff and a number did a lot of work to make sure we do that. And I also speak as chair of we have a task force on looking at crime classifications. And so I think I'm speaking to and asking, I guess I would ask the school system along with kind of, again, what Senator Kagan was raising, what other marketing or other what other interventions have you attempted that don't involve the interaction with law enforcement? Because you're introducing law enforcement into what is essentially a behavioral or a potential school rule violation. So it was intended, the bill did intend to not criminalize or even civilly penalize these types of infractions. So I'm interested in what other things you've done to.
So Senator Washington, as we have for decades, part of our educational program focuses on the dangers of tobacco. It's built into our health curriculum. We have specific targeted events. We do mass market events where we do posters and poster contests and things such as this. We make it a part of most student government. We talk about kids multiple times throughout the year about it. The largest challenge that we have is that at a certain point, the question is, what is an effective, what will actually prevent children from trafficking back and forth with the vapes that they receive and giving them to one another, when we as a school system, we're left with the only consequence we can do is a conference with a parent and perhaps a loss of privilege and perhaps an in-school intervention, because we also certainly don't want to have our greatest consequence that we can give is suspension out of school. So, we wouldn't want to get to a point where we're suspending out of school for something such as this. In the past, we have been able to partner with the juvenile justice system, with the sheriff's department, and with the health department to make mandatory these tobacco cessation classes and hold them over the weekend. And that consequence, that deterrent, that compelled educational experience was something that definitely curbed student behavior of bringing the devices into school, tobacco into school.
Well, I think I would love to work with you about solutions that aren't involving law enforcement. I think that that's the pretty key with what the law was intending to reduce. So thank you so much. Thank you, Chairman.
Thank you, Senator Washington, and thank you for reminding us that you served a one-year sentence on JPR. Senator Fry Hester.
They both did.
Or 2 years.
No. Senator Hester and Senator Washington.
But,
Mr. Chairman,
they were not cellmates. Senator Fry
was partially answered by Mr. Smith. It was, what were the penalties before the law changed? And so was the penalty just simply the over the weekend classes?
Yeah, so before the law was changed, the Student Code of Conduct said that if you have an incident where you're identified as having tobacco, there'd be a conference and an interaction with a parent. The second time, then it would be introduced. You'd actually bring in, and you'd be written a tobacco citation, a simple citation. Your parents would be contacted, and you would have a mandatory scheduled tobacco cessation class that they'd coordinate. The juvenile justice system would coordinate that with the parent, and the children would attend that. And it worked. Honestly, it worked. It worked quite well.
On that Senate bill, Senator Bailey's second bill. Thank all the witnesses for attending and testifying. That concludes that hearing. Now we're going to move to Senator Sidnor, Baltimore County Board of Education election of officers. We'll start with the sponsor, the senator, good senator, and he'll be followed by Nicholas Stewart and Sharon Blake. Welcome, Senator.
Thank you, Mr. Chairman. And just to inform the body, Nicholas Stewart, who was going to testify, him and his wife recently had a baby, so he had to drop off, but his written testimony should be in the file. So it'll be simply me and Mrs. Sharon Blake. So with that said, and I'm gonna ask you to say, and it's not a sentence to be on JPR. I enjoy it.
I was being totally facetious.
I know, I'm just teasing. But anyhow, so Senate Bill 150 is a local bill, and it has not yet been set for a hearing before the Baltimore County delegation. Hopefully we'll have something set within the next week or so. But what the bill does and the impetus of the bill was last December. Annually in December, our board, it hosts an election. Last year, we had a death on our board. The board is comprised of 12 members. And we had a death, so it had 11 members. When it came time to elect a new chair and vice chair, the challenger had received 6 of the 11 votes. The chair at the time received 5 votes. However, because of the way that the law has been drafted, which was that there had to, it looked at the majority of the whole board. A challenger or anyone who was intending to be placed in that seat had to have 7 votes. So although the challenger had received the majority of the votes of those members sitting, she was not allowed to take that seat. And the chair at the time remained the chair. When I first heard about this, it didn't sound right to me. I know it wasn't like an electoral college type situation or anything. So I thought that majority wins, you take the seat. But that was not the case. In fact, I had reached out, got a letter from the county school boards. Their attorney for their interpretation shared it with our attorney general, and they said that the results were correct because it was a majority of that whole board. So you had to have 7 votes in order to be seated. So what we did, we looked at a variety of the school boards around the state
to figure out the best language so that whomever received the most votes would be that person who was seated. Baltimore City had language that was similar to that, and hence that we have this bill. One thing that I have submitted for amendments, one other addition to the bill, which would be to add one additional seat so that the board had an uneven number of members. This particular seat would be an appointed seat, but rather than being appointed by the governor, would be an appointment by our county executive. So that is the bill. Like I said, hopefully we'll have a good hearing in Baltimore County and have a letter to this full body. So with that, I just ask that upon receiving that letter from our delegation, which I'm hopeful to receive, that this particular committee would vote favorably. Thank you very much.
Thank you, Senator Sidnor. Let's hear from Ms. Blake, and then we'll take questions for Ms. Senator. Are you with us, Ms. Blake? Yes. Could you unmute Ms. Blake? Perfect. That's great.
Can you hear me?
Yeah,
okay.
We can. If you raise your screen a little bit, we can actually see all of you.
Okay, can I lean in? I don't. Okay, let me lean in a bit. Good afternoon, Chairman Pinsky and honorable members of the Senate Education, Health, and Environmental Affairs Committee and Senator Sidnor. I am Sharon Blake, a resident of Baltimore County and a retired 43-year career educator in the state of Maryland. I come before you today in support of Senate Bill 150. I'm in support of Senate Bill 150 because this bill is a great way to create a level of accountability for the Baltimore County executive to his constituents. Moreover, it has been said, quote, all politics are local, end quote. Therefore, as a local elected officer, the Baltimore County executive having a voice on the school board would allow the county executive to have a direct and clear understanding of the issues and needs within the county school system. This understanding would lead to better decisions and support of county parents, students, faculty, and staff when approving the budget for the Baltimore County School Board. Also, this bill would put in place the democratic principle of majority rule. When voting, committees, groups, and board members are more effective when majority rule is used as a standard practice. To that end, Senate Bill 150 will ensure the vote for the chair and vice chair of the Baltimore County School Board will occur based on the number of board members currently serving and present for the vote, as opposed to more than a mere majority to affect the change, to affect the change in leadership. It would eliminate a chair or vice chair remaining in office, even if they were not running for said office. In closing, I'd like to thank Senator Sidnor for his leadership for sponsoring this bill, and I would urge this committee to give a favorable report to Senate Bill 150.
Thank you, Ms. Blake. Any questions for the good senator or Ms. Blake? I don't see any hands. There are none, and there's no opposition. There's no opposition in the file as of now. We'll wait until the delegation takes it up and we get a letter, and then hopefully we can rock and roll. Thank you.
Thank you very much for all of your time.
Sorry for the wait.
Oh,
Okay.
No problem. Be blessed, everyone.
Yeah. Senator Simon Ayer, 243. He is the only witness, and then we'll go to Senator Kagan, final bill of the day.
Thank you, Mr. Chairman. Senate Bill 243 is the gambling education bill. I introduced it last year, and I worked towards consensus among the stakeholders. We amended the bill, and it passed nearly unanimously in the Senate. I believe it was 44-2. And then we ran out of time, and the House didn't schedule a hearing. I am happy to report that MABE is no longer opposing it this year, which is another example of working towards consensus. Given I've submitted the exact same amended form, I requested supporters not to give oral testimony, but we just submitted written testimony. So just to give you a brief review of the bill, we saw last year there was a sea change in Maryland's gambling landscape in the last decade. From 2008 to up to 2020, we saw dramatic increases in legalized gambling in Maryland, from slots to sports betting. Importantly, we also saw Maryland's direct role in the expansion of gambling and our knowledge of the adverse effect that it would have on thousands in our state, so much that we created a problem gambling fund. And lastly, we presented studies showing the high risk to our youth, and that 18 to 24-year-olds are the highest risk of developing gambling problem. These are the kids coming right out of high school. So as far as just to remind you what the bill did, it's about educating our students on gambling. The first thing it does, it has MSDE to develop a curriculum and make it available to our local educational agencies, the LEAs. They can create their own or tap into resources already available, and it'll be taught once during a 4-year period in high school. Secondly, for 2 years, it's left up to the LEAs to voluntarily implement some form of gambling education. It's not mandated at the local level, but given the need, we hope they would. And then lastly, after the 2 years, MSDE would report back to the General Assembly which LEAs have included some form of education of gambling in their schools and provide information about the program they implemented. That's the bill. We passed it last year, and I ask you that we finish our work that we started last year for our youth. I would ask for a favorable consideration, and that's the bill.
Senator Riley has a question.
Thank you very much, Mr. Chairman. Senator Simon Ayers, is this a local or statewide bill?
This is a statewide bill, and welcome to our committee, Senator Riley.
You're very welcome. Thank you, Mr. Chair.
Further questions on Senator Simon Ayers' bill? Seeing none, that completes the hearing on 243. Now we go to the final bill of the day, and reminding you that 231 will be rescheduled. We go to 278, Senator Kagan, school-based health centers. We'll lead off with the Vice Chairwoman, and she'll be followed by Robin Elliott, Joy Twasigi, Sean Bolson, and John Willems. And then we have one opponent, Laura Bogley. Ms. Elliott.
Me first?
Please.
Thank you. Thank you very much, Mr. Chairman. Colleagues, last year, this committee and then the full body passed an emergency telehealth bill. We thought it was important, even before the pandemic became clear in its reach, that rural areas and impoverished areas and everyone have access to health care. We didn't want people going into a clinic or a doctor's office if they didn't have to. And telehealth has really taken off. People find it efficient, convenient, and affordable as a concept. And I think medical personnel do too. I think that's been a strategic solution in these challenging times. Unfortunately, our 86 school-based health centers have not been able to provide the same kind of care for our students. Not only is that a problem for our students and their families, but it's also a problem for public safety. When schools were in session, students would be able to walk into the health room, talk to a healthcare personnel, and confide that they're being beaten or that they haven't been fed appropriately. And so issues around abuse and neglect were disclosed. Without telehealth and without access to healthcare, especially, as I said, during the pandemic, but always, our healthcare personnel can't look past the student who's talking and see that the house is really problematic, or hear the screaming, or see bruises. They can hold up, look, this is a problem, and get that kind of care. It's a really simple issue. And I wrote a letter to MSDE, to Dr. Salmon, and asked for her permission and her assistance in making sure that our students and the school-based health centers were able to do their jobs, even though the schools were closed. She pushed it off to the school superintendents, Unfortunately, after checking with our superintendents, they said they did not have the capacity, the authority, and they really needed the State Department of Education to speak up. So this is, again, an emergency bill, just so that we can remove barriers and make sure that our students are able to get health care in these challenging times. Someone used an analogy for a driver's license, you know, that if you get a driver's license that you can kind of drive anywhere and you don't need special permission. And yet telehealth, which is available, should be available everywhere, is currently not. You need special permission. You need an extra step in order to get access in our school-based health centers. I think we can level the playing field and make sure that students and their families, healthcare providers in rural areas and around the state are able to have access. And so I will just say one more thing and then defer to our excellent witnesses, which is we heard from Superintendent Salmon earlier today, and she presented their recovery plan. On page 50 of their Republican plan, they specifically reference telehealth, but they are not a partner in making telehealth possible for their constituents. So with that, Mr. Chairman, colleagues, I'd love to pass it off to Robin Elliott and others, and happy to take questions after that. Thank you.
Ms. Elliott, please.
Good afternoon. Robin Elliott. I'm here on behalf of the Maryland Assembly of School-Based Healthcare, and very much asking for your favorable report on this bill. There are 86 school-based health centers across our state in 12 jurisdictions. They all provide core primary care services. Many of them provide behavioral health care, and some do also provide dental care. Out of that 86 school-based health center number, only about 18 have been approved to provide telehealth services, even in this pandemic. So what has happened is those school-based health centers have essentially shut down. They are not able to connect with students during this period. So this bill is about what is happening in the pandemic, but it's also broader than that. School-based health centers can help our students stay in school. And if they have an illness, what better way than to use telehealth to try to get them back into school? We do know of a set of school-based health centers that applied to do telehealth in early November, and they are still waiting. And so I thank Senator Kagan for making this an emergency bill and ask for the committee's support. Thank you.
Thank you, Ms. Elliott. Let's go to Joy Twisige.
Hi, good afternoon. My name is Joy Twisige, and I'm the board chair of the Maryland Assembly on School-Based Healthcare, otherwise known as MASBC. I'm a nurse practitioner, Baltimore City resident, and a proud parent of a first grader at Medfield Heights Elementary School. So each day, right, in the US, millions of children and adolescents go to school with physical and mental health concerns that threaten their well-being and educational performance. And while Maryland just has a portion of those students, we at MASBC and the staff and all of the school-based health centers across the state are committed to making sure that they get exceptional care. And we exist so that they don't fall through the cracks of our healthcare system. By design, school-based health centers are located in schools with high concentrations of poverty and act as a safety net provider. So we're talking about kids who are homeless, who are uninsured or underinsured youth, youth without a medical home, youth with language barriers. And we establish care relationships, just like you do with your healthcare providers. And the reason we support this bill is because we want to continue those care relationships, meaning we want to deliver care to students who are not physically present in school, whether the school building is open or not. So we want to be able to provide asthma management, obesity management, nutrition counseling, behavioral health, whether there's a pandemic or not. You know, telehealth is a routine part of clinical care now. And so from where we sit, this is easy to support. There are already established uniform requirements for telehealth across all types of healthcare practitioners under the health occupations boards. All school health centers, school-based health centers report visit information to any required federal and state agency including the Maryland State Department of Education. And telemedicine is already being provided in schools. So with community-based behavioral health providers in Baltimore City alone, they've provided over 3,000 visits. So I just want to say that we've already built this infrastructure to ensure that youth don't fall through the cracks. And we just ask you to help us keep that commitment through changing circumstances.
Thank you, and I apologize for butchering your name. Superintendent Bolson.
Good evening, everyone, and thank you. So I'm Sean Bolson, Superintendent of Harford County Public Schools, and I represent the Superintendent's Association on the Commission for the Advancement of School-Based Health Centers. COVID has very clearly underscored the important relationship between health and schools, and I think we can see that on many levels. Our work in schools will most likely from here on out be viewed through the lens of what was pre-COVID and what's post-COVID. I mean, we expect a lot of changes to occur. And this is a time for all of us in education, education policy, educational leadership of any kind to be thinking about what are those things that need to be more present in the post-COVID era, and what are some of those things that maybe we need to leave behind in pre-COVID. And so I would suggest that just like virtual learning, the importance of telehealth has become so much more evident during this shutdown, during the COVID era. And it's an important way to expand access to our access and equity for the delivery of health services in our neediest and most remote areas. And again, we're seeing the evidence of that, similar to the way we're meeting the needs of students through instruction. However, as I said, some things probably need to be left behind in pre-COVID. So what I would suggest is the requirement for MSDE to be the approvers of this process or to certify this process is something that we can leave behind in pre-COVID. I think because of everything we've learned, because our healthcare partners, the schools all have authorized partners. And again, they become so much more adept at the telehealth, and they have to be authorized. So moving MSDE out of this particular process doesn't necessarily, we still have very good protections in place is what I'm trying to say here. So school-based health centers are a resource that help our communities not only improve student health, but also academic outcomes. And I think you've heard a little bit of that from the others. And so we do need to focus our work on this post-COVID world. And I think there's much more we could do to increase the impact of our school-based health centers, and telehealth is one of the really important strategies for doing that.
Thank you, Superintendent Bolson. John Willems. I'm not sure, is John here?
Mr. Chairman, members of the committee?
Yes.
I have been sure to turn off my my YouTube this time, and I will never make that mistake again. So look, MABE is pleased to lend our support for this legislation. And those of us who've been involved in government for many years or decades, we talk about paperwork reduction, we talk about efficiency, we talk about removing unnecessary or outdated bureaucratic obstacles or hurdles or outdated processes. And here's one that we've been talking about removing now for months. We appreciate the Vice Chair, Senator Kagan's leadership on this. And we look forward to the prompt, if not immediate passage of this bill so that we can move forward for the reasons that were so eloquently articulated by Ms. Twessigi and Dr. Bolson. And we really appreciate the legislature's role as appropriate and necessary sometimes to weigh in on what we tend to defend as the education arena, where we like to believe we can solve problems ourselves, amongst ourselves. But we really appreciate the committee and the General Assembly's support in passing this bill. Thank you.
Thank you. Senator Lamb has a question.
Thank you, Mr. Chairman. Thank you for bringing this bill forward. So I guess 2 sessions ago, I was asked to serve on to serve as the Senate's representative on the Council for Advancement of School-Based Health Centers, and have served on this committee, this council for a while. As part of that, have had the opportunity to actually tour some school-based health centers across the state, and have been really impressed by the work that's being done. In looking at this bill, and thank you to the advocates for bringing this forward, It sounds like this bill, and I'm just paraphrasing here, you know, if MDH and MSDE were moving forward with authorizing these school-based health centers in a timely fashion, this bill wouldn't really be needed, right? That is my reading of this, that it's really just to tell them to really move forward with these in approving the ones that really ought to be approved. We obviously have a need in this pandemic to move forward with, telehealth, services at these centers. Is that the proper read of this bill? Maybe this is to Robin or the sponsor.
Senator Kagan, Vice Chairman, you can answer that.
Robin, why don't you snag that?
Sure. So the procedural issue is that MSDE requires all school-based health centers to go through an application process in order to do telehealth. And so what the bill does is remove that application process. So any school-based health center that is already approved as a bricks and mortar provider could then do telehealth.
How many have been approved up to this point? How many that have submitted applications have been approved?
So we think about 18 have been approved. MSD doesn't publish the actual number. So that is actually MASBC's, Maryland Assembly's estimate. And so there are 86 school-based health centers. And, we really think that what we should be doing is really supporting all school-based health centers to do telehealth. So we'd like to get that number up to 86.
So it sounds like it's less than like 20% at that point.
Yes.
Yeah.
And if I could just add on briefly, Senator Lamb, to just reinforce what Robin Elliott said earlier, which is there are 4 applications, 4 requests that have been pending since November. And this should just be quick, and it should just be done. And it should be done statewide.
Right. And are there any other providers that also have to get approval like this, or is this unique in this way?
They are unique. Everyone else has been doing telehealth throughout COVID since our emergency bill was signed. Just to be clear, as you all probably remember, for all the bills that we sent to the governor, most of them were allowed to become law without his signature. He was too busy focusing on the coronavirus. Our telehealth emergency bill was one of just 2 or 3 that he actually signed because it was that important. And yet, we're not making progress.
Okay, no further questions. Thanks, Mr. Chairman.
Senator Fry Hester.
I just had a quick question for Madam Vice Chair. Thank you so much for bringing this wonderful, timely bill forward. My question was, if other laws change this year to perhaps allow telehealth providers from outside the state to offer services, will that carry through to these school-based centers as well?
So I'm going to toss that to Joy, I think, but bottom line is these are 86 finite, discrete school-based organizations. So this isn't throwing open the floodgates to everyone everywhere. We did some of that last year, but Joy, maybe you want to amplify that?
Right. The only way that would impact the care would be like a specialist, and it would be more consultation between the school-based health center with a specialist. If somebody lives on the border somewhere and maybe their their cardiologist is in Pennsylvania or something like that. But this telemedicine bill doesn't mean that school-based health centers can be located wherever in the United States. It
Can
just
I clarify my question?
health centers, that are already approved within the state can provide telemedicine services.
Senator Fry Hester.
I just wanted to clarify my question. Earlier today, we heard that there's a shortage of different types of providers. And so I'm actually supportive of telehealth reciprocity between states. My question was, is this bill structured in a way such reciprocity topic, passes another piece of legislation? Would our schools be able to have reciprocity with providers in other states?
Senator Kagan, would you like me to answer that question?
Go for it, Robin. Thank you.
So Senator Hester, for school-based health centers, because they are a bricks and mortar provider, they're always going to have an anchor of a Maryland licensed practitioner, usually a nurse practitioner or a pediatrician. What this out-of-state reciprocity could do, as Joy said, is it could make it a little bit easier to connect the student with an out-of-state provider. And as Joy pointed out, especially for students that may have to travel, let's say to Philadelphia to see a specialist, this would allow the nurse practitioner, Joy, to connect that student to the specialist within the school wall. So yes, I do think it's related, and this bill would help that.
Awesome. Thank you so much.
That completes the proponents. We have one opponent.
Mr. Chairman, I see two hands up from colleagues.
I apologize.
Senator Carozza.
Senator Simonero, then Senator Carozza. Thank you.
Sure.
Thank you, Senator. And I commend you for the goals of this bill. I appreciate it. And I think it's important that our students have access to healthcare. Let me just get up a little higher profile because I'm not that familiar with this. What is the process? So we have these health centers, and the students, when they were in school, normally could just go to this and get healthcare. Now we're out, so they're looking to get telehealth. Can you just go over real briefly what the process is? You know, the student comes in, who pays, just the logistics of how this works.
I defer to Joy or Robin on the details.
Joy,
Right, so the students enroll, so they enroll in the school-based health center for care, and they come in. If they have insurance, then we can bill the insurance. This is all sort of variable across the state, but school-based health centers have the ability to bill. We have a location code within Medicaid. We have some, braided funding so that we can, since we are a safety net provider, we do see students who are uninsured or underinsured. School-based health centers are vaccine for children, many of them vaccine for children centers. So we're providing vaccines through that federal and state process. So there are revenue sources, but a lot of also what we do is not reimbursed. And so we seek out grants at local and state levels.
Gotcha. So do I understand these are not co-located in the school? These are separate building or organizations?
No, we're in the school. We're
in the
school building. Mm-hmm.
Okay. And then back to the senator. So would this bill expand it to other organizations that are in the building? Is that the intent? Or that, I guess it would be telehealth at this point.
The intent is to empower 86 school-based health centers to provide health care for the students, as they have been doing. Robin, would you add anything?
Senator Simonero, it's for the existing providers. Joy's one of them. And it's allow them, they have an existing school-based health center that's approved by MSDE. And it's so that all those health centers can connect to their students.
Gotcha. So you're not trying to expand the 86, you're just trying to get it up so you can have 86 working with teleworking.
That's correct, because only about 18 have been approved to do telehealth. So a lot of the school-based health centers have shut down. This, of course, is a terrible time to lose that connection between students and their healthcare providers.
And then the last question I have is, so the services they provided when they were in school normally, does this bill expand any services that they could receive that they would not, sorry about that, they would not receive prior to the COVID in this legislation?
It does not. So school-based health centers, MSDE has a sort of tiered system by which school-based health centers become more comprehensive. Those services are primary care, which is, kind of the scrapes and bruises that happen during school, as well as some chronic disease management. Many school-based health centers do behavioral health, and a few provide dental services. in order to provide any of those services, that has to be part of when the school-based health center applies to MSDE for its bricks and mortar location.
Gotcha. Thank you.
Thank you, Senator Simoner.
Senator Carrozza.
Thank you, Mr. Chair, and thank you, Madam Vice Chair, for this legislation. I appreciate you gave me the opportunity actually to work with Robin Elliott on an amendment that to allow for more out-of-state consideration and services with the telehealth bill. So thank you for that. Along those lines, and I think I will direct my question to Robin, Ms. Elliott, if that's okay, Madam Vice Chair, regarding just two quick questions. The Maryland Department of Health was raising some questions just about they mentioned a checklist in their process that this bill might affect. And then they also mentioned a liability issue, saying that may be an unintended effect that MSDE and the Maryland Department of Health would have no authority over program standards while still being subject to liability or unanticipated negative program impacts. So I just wanted, first, Ms. Elliott, if you could comment on just those 2 points. And then there's also a letter from the Maryland Right to Life concerning abortion services. So if you could comment on those points, I'd appreciate it.
Sure. So the Maryland Department of Health and I believe the Maryland State Department of Education both submitted testimony, and they said similar things. The checklist that they discussed is very operational. It's things like making sure that labs requests are submitted. Those are all things that any provider is going to know how to do. When you all passed Senator Kagan's bill last year, what you did in telehealth is set uniform standards, whether it's a nurse practitioner or a physician or an occupational therapist, all the things that are required for telehealth. So we think that that checklist process is now duplicative. And then the second question about liability, that is not a concern that any of the school-based health centers have had or their sponsoring organizations, some of whom are on here supporting the bill. All the bricks and mortar providers that have converted to telehealth over the last 6 months have all worked to make sure that their liability coverage extends to include telehealth. So it's a very workable issue that thousands of other providers have been able to deal with. And then Senator Carrozza, would you like me to address the Maryland Right to Life letter? So I did read the testimony. The concern that the letter raises is whether or not this bill essentially opens the door to school-based health centers providing abortions through telehealth. That is not the case. There are two pieces of information I'd like to relay on that. The first is that school-based health centers do not provide abortion services. That's beyond the kind of core primary care services that happen. And that is something that needs to be done by someone with expertise in that particular type of service. So it doesn't happen now, and there's no intention it would happen in the future. The second thing is that telehealth for abortion is actually restricted because of some FDA regulations that require the medication used to be actually handed in person by the provider to the patient. So telehealth isn't a medium that can be used for that service anyway, and that's an FDA restriction. It's something called the REMS. And happy to answer any more questions.
Okay, thank you. That concludes the questions for the proponents. We do have one opponent, Laura Bogley. Ms. Bogley, you want to speak to your opposition to the bill?
Yes, thank you, Chairman Pinsky and distinguished senators. My name is Laura Bogley, and I'm the Legislative Director for Maryland Right to Life. On behalf of our pro-life members across the state, I respectfully object to Senate Bill 278 as written. While telehealth is a worthwhile goal for the state, teledeath must be expressly excluded from all telehealth policy. By reducing the standards for school-based health centers to participate in telemedicine, the state will be positioning the abortion industry to gain direct access to vulnerable minor school-age children without their parents' knowledge or consent. Once the FDA restrictions are removed, the remote sale and distribution of abortion drugs through school-based health centers will pose a serious risk to the health and safety of school children, and this is an egregious violation of parent trust. President Biden has said that he intends to remove these FDA restrictions, and Maryland's Attorney General Brian Frosh has sent a letter to the FDA asking him to move these restrictions. We respectfully recommend that you heed the Food and Drug Administration's existing safety restrictions on remote distribution of abortion drugs. The FDA requires that abortion drugs be distributed only under the supervision of qualified healthcare providers because of the drug's potential for serious complications, including severe hemorrhage, viral infections, pelvic inflammatory disease, loss of fertility, and even death. A physician's examination is necessary to assess the duration of pregnancy, diagnose ectopic pregnancies, and provide any surgical intervention for failed chemical abortions. Finally, pregnancy is not a disease. Maryland taxpayers should not be forced to fund abortions. Public funds instead should be used to prioritize health and family planning services, which have the objective of saving the lives of both mothers and babies, including programs for improving maternal health and birth and delivery outcomes, well baby care, parenting classes, foster care reform, and affordable adoption programs. For these reasons, we respectfully urge your amendment to preserve the otherwise good purpose of this bill or issue an unfavorable report on Senate Bill 278. Thank you for your time.
Thank you, Ms. Bogley. Any questions for Ms. Bogley? Senator Simon Ayer.
Yeah, thank you. Actually, it's to the sponsor based on her testimony. I just heard Robin and mainly Robin, but it doesn't sound like it's your intention to introduce abortion into this process that's currently there. So I guess my question is, would you be open to just putting an amendment to clarify that's the intention and then there's no question about it?
I think I would need to have conversations with colleagues and advocates. I don't want to undercut access to healthcare, but Ms. Bogley's examples of ectopic pregnancies and personal exams to see how far along a pregnancy is and all that, none of that would happen under telehealth. And this bill is a telehealth bill.
So you'd be willing to look into that as far as just making sure that's not part of this bill?
I would prefer not to say yes or no at this moment, Senator Simon Ayer, but I'm happy to have the conversation, as I'm happy to have all conversations.
Okay, one last thing. I asked Robin the question, is it your intention to allow abortion drug to be telehealth if the federal goes away? Senator Kagan.
Oh, I thought you just said Robin.
No, I talked to Robin and she said it wasn't their intention that they did this.
It's not the intent is to make sure that kids who rely on school-based health centers have access to health care, even during a pandemic. So not looking to expand services, looking to provide services. So I'm happy to chat with you and to see whether you've got proposed language and talk with others and see what they think.
Okay, thank you.
Okay, seeing no further questions, that concludes the hearing on this bill and concludes our hearings for today. We've actually done between the three hearings today over 5.5 hours. Thank you, committee, for your engagement and participation. I believe we meet again at 11 o'clock tomorrow. And so we are adjourned for the day. Thank you. Thank you, witnesses.
Thank you all.